The GSK ERI was established to provide grants to support independent, non-clinical research focused on improving the understanding of the epidemiology and genetics of breast cancer in ethnically diverse, non-Caucasian populations of the world. Grants will be provided annually to investigators in Latin America, Asia, Middle East and Africa, or in other countries with ethnically diverse populations, excluding the USA and Europe. Research projects considered may include breast cancer epidemiology, ethnicity, genetics, risk assessment, biomarkers of risk or other factors causing or contributing to breast cancer, and other aspects of non-clinical research. Of the 3.2 billion women in the world, 90% are non-Caucasian. Over the last few decades, the incidence rate of breast cancer has grown rapidly in many developing countries compared to developed countries where growth is slower. Despite the fact that the incidence of breast cancer is higher in industrialized nations, the burden of disease is greater in developing countries where 80% of cases are first detected at advanced stages of the disease. In 2009, Dr. Beena Devi, head of Sarawak General Hospital's Department of Radiotherapy and Oncology, DRO, was amongst the first researchers in the world to be awarded funding as part of the GSK ERI initiative. The successful research project will investigate the epidemiological and clinical profile of breast cancer in 3 ethnic groups in Sarawak, Malaysia, those of the Dayak natives, Malays and Chinese. The study intends to evaluate treatment and outcome differences amongst the 3 groups and compare these findings with the socio-economic determinants of access to breast cancer diagnosis and treatment. Preliminary, primarily anecdotal data suggest that there may be large and significant variations between the groups regarding risk factors, incidence, therapy, and outcome. If this can be confirmed, it would facilitate changes in the healthcare system to address disparities and improve care. According to Dr. Beena, there has been a significant lack of research conducted to date in ethnically diverse women, particularly in the state of Sarawak. She said that research grants such as these are critical to furthering our understanding of how breast cancer is linked to ethnicity and hopes it inspires other researchers to focus efforts in this area.
Okay, since the establishment of the department in 1985, I can proudly say that we have had some achievements since 1994. In 1994, we actually set up the daycare chemotherapy setup, which helped to actually give chemotherapy on day basis, and then we also established a downstaging program mainly to reduce the number of late presentation which we were seeing in 1994, and then when we set up the program whereby we educate the rural clinic nurses who will then train and educate awareness in the community, we found that in the year 2000 there was a downstaging which was established for breast and cervical cancer, but not for nasopharyngeal cancer. But the very fact that we were able to establish that for breast and cervical cancer, we thought that was a great achievement, because it is not easy for patients to present in early stage. And subsequent to that, we went on to then establish the fact that nasopharyngeal cancer was our most common cancer in not only in Sarawak. We also established that we had the highest incidence of nasopharyngeal cancer in the Bidayus, which is a special ethnic group of Sarawak, and this was a landmark paper in one of the reputable journals. And following that, we went back to retrain our rural health nurses in the rural clinics, and then when we looked at the data again from our case records, we found that we were able to achieve a downstaging for nasopharyngeal cancer only for Syrian district in the year 2005, and that we think came about more from community awareness, because there is no specific screening tool or program established for nasopharyngeal cancer. And the other thing that we set up, which was in 1994, was a training program for palliative care. And we also set up the hospice home care and palliative inpatient care for the whole state of Sarawak, whereby any terminally ill patient who gets discharged from this department is ensured care till the person dies. And that means all drugs and whatever symptomatic care is required, that is sent to the patient's home. And we also had trained rural nurses who will visit the patient's home, and that program has been successfully running since 1994, and we had published our results in a reputable journal. And this year in February, UICC, which is a large international cancer organization, selected our paper and chose the type of setting of palliative care as a model of care for countries with limited resources.
Breast cancer is the most common female cancer in Sarawak, and its incidence is increasing as in most developing countries. Since 1992, the number of breast cancers has multiplied by 4.2 times. Of the 250 cases reported in 2007, 55% of the patients are under 50 years old. The epidemiology and clinical characteristic of breast cancer among natives, Malays and migrant Chinese have never been studied. Early research shows there may be large and significant variations between the groups, such as age of diagnosis, incidence, risk factors, clinical histopathologic characters, therapy, and outcome. The study is aimed at exploring the clinical profile of these three ethnic groups of Sarawak. Dr. Bina said that while the study could potentially aid in assessing survival in various subgroups of patients and identify gaps to be improved, it could also help to identify and characterize sociologic and economic barriers to effective diagnosis and treatment in these three ethnic groups.
Research proposal on ERI actually came about because as part of what we have been doing on our early cancer surveillance program, we usually look at our data, and we knew that we are actually getting our patients which were downstaged. But we did not only look at staging, we also looked at other parameters. Okay, for example, like age of presentation, and what was your body weight, and also the tumor characteristics. So when this ERI thing came about, okay, we decided to participate and sent in the proposal, because we thought that since we already have a 6-year data, why don't we expand that data to a longer period? So now we will have roughly about 12 years data, of which 2 will be prospective and 10 will be retrospective, and then we will be looking at the epidemiological areas, okay, and we will then look at the tumor characteristics. We will be looking at survival data, because it will give us an idea as to did our early detection program, how did it translate into the survival, what was our benefit in having this downstaging program, and lastly and more importantly, whether there were any socio-economic barriers as to reasons why some women present late. So that will form part of our prospective study, because we would like to know what are the deterrents for patients to come forward for treatment. So this, by looking at different aspects of breast cancer, and why we chose breast, okay, maybe because the ERI was on breast, the topic was on breast, but more importantly, breast cancer is the most common cancer in Sarawak, just as in Malaysia too. So I think the results of this study will also help to generate further research, not only in Sarawak, I think also for others to do, because it will give some pointers. We may find some things which will help us to further improve what we are doing at the moment now.
It is anticipated that this study will yield useful clinical and epidemiological information in assessing the degree to which these Malaysian subpopulations differ from each other with respect to breast cancer, and facilitate changes in the healthcare system to address disparities and improve care. Internationally renowned breast cancer expert Carlos Barrios is a GSK ERI International Steering Committee member. He said that most breast cancer research over the last 50 years has been conducted in Western countries and in Caucasian women, leaving a large gap in our understanding of the epidemiology and genetics of breast cancer in ethnically diverse populations, and that research projects such as Dr. Bina's will really help to bridge this gap.
The GSK Ethnic Research Initiative is a program that was designed to fund research based on the epidemiology and genetic makeup of breast cancer patients in specific populations across the world. This initiative is critically important because most of the knowledge we have today concerning breast cancer comes from research conducted in Caucasian women in developed countries. So we lack information in populations, specifically in certain parts of the world. The idea of finding out what's the best way of discovering breast cancer in these populations, of detecting the best way of screening these populations, of identifying best treatments and treatments more effective and with less toxicity in these populations are probably some of the major benefits that this project is going to have across the world. I'm very proud of being associated with this initiative because it's a first, it's original, and it's definitely, in my view, going the next few years have far-reaching consequences in not only research, but only in the care of patients with breast cancer across the world. The GSK Ethnic Research Initiative has been funded by GSK, but the whole process of establishing guidelines, leading with the whole process of accepting the applications and selecting the applications is completely independent from the industry. One of the critical aspects of this program is that it is being designed to solve a need for information, a need for data, a need for scientific information that will help us not only detect cancer in these populations at an early stage, but treat them better. I do establish a direct relationship between research and results in clinical practice. So in places where you have good research, you certainly are going to have better results in clinical practice. So survival is going to be better, treatment is going to be better, and patients and women with breast cancer are going to be surviving longer. We are just touching the tip of the iceberg. Once the program keeps rolling, I believe that we will be facing with more and more surprises, with higher and higher numbers of applications from all over the world.
The expertise and infrastructure at Dr. Bina's disposal to conduct these studies is impressive. It includes the sole hospital treating cancer patients in Sarawak, Malaysia, a substantial population of patients, comprehensive electronic medical records, and an established and experienced team of epidemiological researchers. Dr. Bina, who is principal investigator on this project, has also served as principal investigator on several ongoing studies and completed ones. She is also a reviewer of international journals and has 7 recent publications.
This is our palliative care ward, okay, meant for patients who only will be requiring palliative care. And we actually purpose-built this ward because we wanted it to be different from what our general ward is like. The main reason being, while they're staying here, comfort is important. At the same time, we want to make it like a home. So every patient bed has got its own private area because it is separated by a semi-partition, and but that also allows the nurses station, which is located centrally, to visualize all patients at the same time and because every patient has a separate unit, we make sure that every unit has a fan of their own, so that we don't, it's not like in a general ward where 4 patients share one fan. Each patient has got its own fan. The caregiver has separate bed to sleep, so that they will also be comfortable while they are staying here. In order to improve the environment, we actually had a little balcony garden where patient can also look out and do not feel that they are in a general ward. So that is why a balcony garden was created, so that it makes them feel more like in a home environment. This is our aromatherapy room. The purpose of having this room was actually to provide an enhanced pain control management, in addition to our usual medication that we will use for pain control, and also for patients who are very anxious and who would need a massage for some relaxation before the treatment. So we thought that maybe we can actually enhance the care that we can give to our patients by having a relaxing massage. That's why we had this room, and it's one of the first, I think, in government hospitals.
Dr. T.S. Tang, Sarawak's pioneer physicist since 1984, is co-principal investigator on this project. Dr. Bina will also work with Lee Chai Yuan and Felicia Tang with the collaboration of Marilis Corbex, a former researcher in the Etiologic Epidemiology Unit at the IARC, to help in analyzing and interpretation.
We are preparing this patient for the treatment of nasopharyngeal cancer. It's the treatment of the cancer behind the nasopharynx. This machine is the CT simulator. It's like a CT scanner, but with additional facilities which allowed us to use the image for the purpose of planning. Now, CT simulator is a very essential part of our service, because it allows us now, which we have acquired only a year ago, it allows us now to use this machine and to produce the image which we can use for very sophisticated treatment planning. And we can treat the patient using the technique called IMRT, which is the short form for intensity modulated radiotherapy. Now, IMRT is a high-end treatment. I'm proud to say our department now, with these facilities, and of course the appropriate treatment planning software, allowed us to do IMRT treatment, which means we can treat patients more accurately, at the same time sparing the regions which we don't want to treat, because we are treating in the head region. There are quite a lot of critical areas. So IMRT allowed us to spare these regions. So with the image we have acquired from the CT simulator, which is now exported to this treatment planning system, now we are able to carry on with our IMRT treatment planning. So after the oncologist put all the relevant volumes of treatment volume, organs in which to avoid, then our physicist here, Mr. Woon, would be able to carry on with our treatment planning system. So the part of the advantage of IMRT is that it is able to curve around organs in which we want to avoid, so that it allowed us to treat the organs, to treat the target volume that we want to treat, at the same time avoiding important areas, for example, in this case, the spinal cord, so that it won't be treated to the certain dose. So the computer will go through its optimization, and in this case, it's actually trying to work out, as you can see, trying to work out what is the best solution in which we can treat this region without excessively irradiating the surrounding normal tissue. You can see there is of curving around, which is the important advantage where IMRT can offer us.
Dr. Zulkifli Jantan, Director of Sarawak General Hospital, commended Dr. Bina Devi and Dr. T.S. Tang on their efforts. He said that the study will help place the Sarawak General Hospital and Malaysia on the global map for research of cancers affecting women.
The Department of Radiotherapy and Oncology, or SGH, was set up in August 1985. In the beginning, we started with about 250 patients, But now the numbers has grown manifold, and the last year alone, we saw 1,500 patients, and also another 10,000 follow-up cases. The most common cancer cases that we treat at SDH are breast, nasopharyngeal cancer, cervical cancer, lung, and colorectal. We have a very strong heritage as being the second public hospital in Malaysia, only after Hospital Kuala Lumpur. It is our vision to establish ourselves as a center of excellence, firstly in the treatment and management of cancer, and secondly in research and development. In terms of research, I am happy to say that the Department of Radiotherapy and Oncology has achieved many landmarks, resulting in the publications in internationally renowned medical journals.
The GSK ERI was created in 2008 in response to a recent study which highlighted the high proportion of younger, ethnically diverse, non-Caucasian women presenting with more aggressive tumors and the lack of genetic research in this population. Dr. Jorge Otero, Vice President of Oncology Center of Excellence, Asia Pacific, Japan and emerging markets at GlaxoSmithKline, says that the ERI program has been developed by GSK to address the needs for a more specific breast cancer research in ethnically diverse populations. GSK is proud to support independent research projects and hopes the findings generated will help achieve the ultimate goal of reducing breast cancer incidence, morbidity, and mortality in ethnically diverse populations of the world.
In the next few years, more than 60% of women with breast cancer will be diagnosed in non-Caucasian populations. The GSK Ethnic Research Initiative program was in response to a study that was conducted by the University of Massachusetts School of Public Health. The study underscored that younger women are being diagnosed in non-Caucasian populations at a younger age with more aggressive disease compared to Caucasian patient populations, and also underscored the lack of appropriate information or appropriate clinical research. For the last 50 years, we have gained understanding of the biology of cancer, and particularly the biology of breast cancer. But most of this research has been conducted in Western countries, mostly in Caucasian women. So if we can gain understanding of the biology of the disease, the epidemiology of the disease, and some molecular biology in non-Caucasian patients, particularly with breast cancer, it will help to advance clinical research and basic research in breast cancer patients. The reaction from people across the region in Latin America, in Asia Pacific, Middle East, North Africa, and South Africa has been tremendously encouraging for us, because most of these investigators or most of these key experts in the area are telling us that this is probably one of the first ever initiatives that is attempting to clarify this question of potential ethnic differences in breast cancer patients.
GSK is committed to promoting excellence in scientific research. Every effort has gone into ensuring that the GSK ERI is conducted in an ethical manner, with the independence of the application's review rigorously maintained. The application review and final selection of grant recipients are conducted by an independent expert steering committee, over which GSK has no influence. GSK encourages any investigator working in the field of breast cancer in Malaysia to consider applying for a GSK ERI grant. Researchers interested in submitting an application for the next round should email the GSK ERI project manager at gsk.eri@innovara.com to request a copy of the research grant guidelines and application process.